Hi, I'm Montgomery Township Mayor Sadaf Jaffer, and I have a COVID-19 community update. Today I'll be discussing contact tracing with Montgomery Township Public Health Nurse Katie Williams. Thank you so much, Katie, for joining me today.
Yes, thank you so much, Mayor, for having me.
What many people don't know is that public health nurses across the country have been working behind the scenes nonstop for months now. Public health nurses are our hidden heroes who are doing important detective work for our health departments, interviewing each person in our community who has tested positive for COVID-19 and trying to figure out who they've been in contact with. This is vital in preventing community spread of COVID-19 and keeping us all safe. So I have a few questions for you today that I'm sure will help our community understand what's taking place and more about your work. What has your experience been like these past few months?
So that's a great question. I feel like one of the key things is we've obviously been a little busier than we would typically be pre-pandemic, which makes sense. Contact tracing isn't new to public health, but contact tracing at this scale is definitely something new. So even though we've been busier than we typically have been in the past before the pandemic, we do have additional help, which has been so essential to our response. So we have additional contact tracers that are helping out with our COVID-19 response, which has been key for this community, I think.
What does your typical day look like? How do you find out about cases in the community?
Yeah, so a typical day, we're dealing with COVID-19 every day. So a typical day involves multiple questions about COVID-19, whether it's related to guidance. And also, anytime there's a new case in a town that we cover, we reach out to that individual. We also are regularly reaching out to close contacts, whether it's the first time we're reaching out to them or whether we're checking in on them, whether it's a case during their isolation period or a close contact during their quarantine, to see how they're doing, to make sure that they still have what they need to isolate and quarantine safely. So COVID-19 is a reportable communicable disease in New Jersey and throughout the United States. So anytime someone has a positive COVID-19 test, that gets sent to the local health department from the lab and from the provider. And then what we do with that is once we get that result, we reach out to the individual. The most important thing is just to make sure that people, are continuing to improve. If they, we want to make sure that they have a healthcare provider that they can reach out to if they have questions or if their condition worsens. If not, we can help link them up with some providers. We also want to make sure that they have what they need to quarantine and isolate safely. So do they have access to groceries? Are they able to get medications? If they don't, we can help link them up with a couple of different services in the area. And then the other important thing is we do, we want to figure out if they know how they may have been exposed. And we also want to figure out if they've had any close contact with anyone else while they're contagious. And then what we do with that is we will reach out to any close contacts. Again, we keep the information about the positive case completely confidential. Most of the time, the contact tracers may not even have all of the details about the particular investigation, so we are keeping that confidentiality. And then we just notify them that they've been exposed and review the quarantine process.
I know that I've gotten this question from members of the public. I found out that someone in my household is COVID positive. Should they proactively be reaching out to the health department?
Yes, so I think that's a great idea. So we are always here. We're finding that, sometimes there are lags in reporting. There's a number of reasons that factor into that. Sometimes it depends on, whether or not the right address is entered. There may be delays. So if you haven't heard from the health department in a day or two after someone's had a COVID-19 diagnosis, please reach out to us because it's possible that we just don't know about it yet.
And what would be the best way for people to do that?
So they could give us a call here at the township. And then, if you don't get someone on the phone, depending on when you're calling, you can, call my direct extension, which is 2235. If you do get someone on the phone, if you're calling during the day, just have them connect you to someone on the contact tracing team.
Great, thank you.
Yep.
Having spoken with so many people who've tested positive for COVID-19, what have you learned from their experiences that you would like to share with the community?
So that's a great question. I feel like sort of overwhelmingly, the people that we've been talking to in this community have been really, willing to talk to us. They pick up our phone calls, which is great. People want to do the right thing, and they want to do what's needed to, keep their family, their friends, and the community safe. So this is, not only what I've heard, but this is what our team has heard, which is really reassuring.
What are the biggest challenges you've faced during this pandemic?
So I think that one of the challenges is that this is a new infection. This is a novel virus. And so we continue to learn more about this each day. There's a lot of guidance and recommendations that are out there. And so we try as best as we can to keep up to date with those so we can provide those to the community. But that is definitely one of the challenges. There's a lot of information, different places. So it's really good to go to reliable sort of resources like the CDC, New Jersey Department of Health. You can always call us if you have questions. And then I think the other challenge that we're all starting to feel a little bit, including myself, is that, this has been going on for months. So, we're starting to feel a little, pandemic fatigue. Having said that, it's still so important to continue to do the things that, the community has been doing, which is, wearing a mask, maintaining social distance, and then also, washing your hands. So they're small things, but they do really have a big impact. And we don't, you may not necessarily see that yourself, but when you see it at a bigger scale, even for our contact tracers that are, talking to people, those things in particular, the social distancing and, adhering to the recommendations depending on what setting you're either working in or going to school in or going to daycare in, those policies and procedures really do help reduce transmission. So it's a lot of extra work, but it's doing what it's supposed to do.
So what are your thoughts on how we as a community are doing in this pandemic?
I think that this community in particular has fared, fairly well compared to other communities of a similar size in this region. There are probably a number of factors that are contributing to that. I think one of the things that help is, this community is really willing to implement a lot of the public health recommendations. They're also, really willing to pick up the phone when we reach out to them, which is helpful. So we have a couple of things available to us right now to help prevent the spread. And one of those things is contact tracing. And so picking up the phone does help a lot. So we really appreciate that.
Good job, community. Thank you all.
Yeah.
Is there anything else that you'd like to share with the public, just as a message to the public at this point, as we have been facing the pandemic for some time now?
Yes. So, like I had mentioned before, the next few months are a little uncertain. We're seeing, an increase in cases regionally and throughout the states. There's a lot of new information. Sometimes it might be confusing, but if you just stick to some of the key things that have been around for months now, wearing a mask, social distancing, washing your hands, that does have a big impact. And again, you may not be able to see it right away, but it does help. So, keep doing what you've been doing. I feel like this community has been doing a really good job with it. So just keep up the good work, and we'll get through this.
Thank you so much, Katie. Thank you so much, especially to you for the work you've done for our community to help keep us safe and healthy, and to everyone in the health department. Thank you again.
Great. Thank you so much for taking the opportunity to talk about this with me. Bye. Bye.